morning. Sloan, do you want to go next?
Yes, thanks, Rachel. Good morning. Hi, everyone. I'm Sloan Henry. I am the community health educator for the consortium. I also work with the tobacco and health equity work groups. And as Tessa said, if anyone would like to reach out and just have an extra set of eyes on their application, I would be happy to do that and happy to provide some input if needed. So thanks so much for attending today.
Awesome. And then last but definitely not least, our intern Abigail, do you just want to say hello and kind of what areas you're interested in?
Yeah, thank you. So I'll be a senior at the College of Public Health at the University of Iowa this fall. I've been working with HPV group and colorectal and just listening in and helping with the team meetings and stuff like that. But very interested in environmental health and how that impacts our health. So thank you.
Awesome, awesome, awesome. Yeah, like I said, we're going to keep this meeting pretty informal. I'm going to share with you just a little bit about where the documents are and just kind of walk you through what our process is. But if at any time you have questions, do write them in the chat or even unmute yourself, and we'll be able to answer those for you, hopefully. So with that, I just wanted to, you'll see our website here on the main screen. And I really just wanted to point you all or direct you all to we have a grants tab. And under here, we have the FY21 Iowa Cancer Plan Implementation Grant Invitation for Proposals. So what we have tried to do this year is to kind of take away the number of attachments that people have to open to hopefully make it easier for everyone. So what we did is we tried to put everything that anyone would need on this webpage. So here you'll find a little description about the grant mechanism. We'll talk a little bit about what our board has indicated as funding priorities. But then I just wanted to point out we have our application documents right here, including instructions, an application in Word, your scoring rubric. We have some tools that we'll go through that will just, again, be able to help you in the application process. And then we've also organized just our key dates here. So we'll kind of walk through all of this morning, but I just wanted to let you know that all of these are available on the website. So if you do have any questions or need to reference anything, this would be the place to go. So I think one of the main things I just wanted to point out, which I think all of you are very familiar with, is that cancer is an incredibly complex disease. And that's part of the reason why organizations like the Iowa Cancer Consortium were started. There are cancer coalitions just like ours in all of the 50 states in the United States. And we think one of the things that we're really good at and are able to offer as a benefit to our partnership every year is this invitation for proposals. So using funds that we receive from the Iowa Department of Public Health, and it's a mix of both state and federal funds, we're able to offer out this opportunity to send to community members funds potentially that link to our Iowa Cancer Plan, which if all of you are familiar with that, that's kind of like our blueprint document that really outlines both metrics and objectives that we as a collective partnership have indicated could be moved upon to reduce the burden of cancer in Iowa. So if you haven't had a chance to review that document, again, that'll be on our website as well, but it covers topics, so cancer prevention, so anything from radon, sun safety, nutrition, vaccinations, to early detection and screening, which we talk a lot about colorectal cancer, breast cancer screening, lung cancer screening, treatment, which kind of in there, we have a lot of hospital and cancer center folks who are on board working on different research initiatives, clinical trials falls into that bucket, and then survivorship and quality of life. So really like the breadth of all the different topics that are covered under the cancer plan, we really feel like you'll be able to find an area to really mix, like what your passion area is, what project you want to do, you'll be able to put that into the cancer plan and really see how they match up. And one of the things that we do really like to focus on throughout that whole cancer continuum is really just the piece about health equity. So just the fact that it's not enough to say, well, you know, my program's open to anyone, you know, I'm addressing these barriers, but to really challenge yourself to dig deeper as a program or as the project that you're looking at, and really try to figure out what might be barriers to access for some of your programs and how could you overcome that. That's something that has been a priority for the organization, and really, especially in these current times of coronavirus and tackling racism in an open way, that's really what we want to see out of applicants. So we will talk about that a little bit more, but that's kind of the 10,000 foot overview. So the other thing I did want to point out is typically our grants, we release them in March, and that was kind of just when everyone was starting to work from home and the coronavirus pandemic really picked up. So one of the things that our board did was to really look intentionally at the IFP process and say, okay, you know, given the global pandemic, like what are we going to do with this funding to be the best stewards of these dollars? And it was through a lot of discussion, it was the viewpoint of the board that we would put a temporary pause on asking for applications to kind of let things fall where they would, and then that we would bring this back up in the summer and offer funding opportunities. So that's where we're at right now. As a result, typically our project period for grants is from July to June in any given year. And again, because of the delay and the pandemic, we're now looking at a project period of like the beginning of October all the way through like the end of May, like the very beginning of June. So any questions there about that? Okay. The other thing I wanted to point out was being that the board decided to delay things and then bring it back up in the summer, they also had highlighted 4 key areas that they really want to make sure receive priority funding. So I'm going to walk you through those right now. So right here on our website, we have those board priorities. So any projects providing support for communities who hold the burden of both cancer, and so you can kind of define that how you will, and novel coronavirus. So as the consortium, we really want to be meeting people where they are, meeting those needs and providing funding support there. So that's one priority. The second priority is programs that identify creative ways to deliver cancer services and care within the new landscape created by the pandemic. Third is projects that address systemic racism and inequities across the cancer continuum. So again, that could be from prevention, screening, treatment, quality of life, all of those things. We really want to make sure that every project that we fund has looked at their project with a health equity lens and built in protections within their grant to address those issues. And the fourth priority, which these aren't given any more weight than others, except for this one, we did have a select number of grantees from our last year, so fiscal year 20, I think Julie, you were one of them, who willingly relinquished funds so that the consortium could provide transportation and lodging support to patients during the COVID-19 outbreak. So that's one of the ways, like within our scoring rubric, that we've kind of changed things a little bit so that people who did give up funding last year would kind of receive that like priority if they submit another application. Kelly, is there anything that you want to add there that I missed as far as the board?
I think you hit it spot on.
Okay, awesome. Okay, so I just wanted to touch on just a couple of areas where you may notice some changes if you're kind of a consortium lifer. So we did update the look of the application, so you'll notice that's a little bit different. We tried to make it be a little bit prettier and more welcoming, so you'll notice that has changed a little bit. You'll also notice a change in the number of documents available, again, just to try to make our brains function easier, that you don't have to flip through 12 documents to find what you need. So we changed that a little bit. We have the modified timeline, so you'll find that in here. And yeah, other than that, not much has changed. I think one of the points that we really wanted to hit home today is that our consortium staff are all working from home, but we are incredibly excited to work with the projects that are coming forward. And we as a staff don't score the applications, so therefore we can actually help you put together your application. So if maybe you have questions about the budget or really want to know, how can I look at this with a health equity lens more? I don't understand. We want you to be able to feel comfortable to reach out to any of us, and we want to help you with that application. So let's see. I talked a little bit about the project period being a little bit different. I want to go down here to key dates. So we released the IFP last week. Today is our webinar, which I did want to note will be recorded and put out if anybody wants to watch it again or you want somebody else to watch it. We are asking for a letter of intent. So that is required, but we don't want that to scare anyone off. The letter of intent can be a very simple couple of sentences like, my name is Rachel, I work at company ABC. I'm really interested in writing a grant about how sunscreen is important at daycare centers over the summer or something. Again, so this letter is required to submit, and really it's not for us to weed out projects, but it's for us to get a better understanding of what kind of projects are coming in, where there might be duplication, that maybe, maybe Tessa's working on the same thing. I might be able to connect her to see if they might want to work together. And it also helps us just prep as far as like our board review, who will be scoring the applications this year, to know, are we going to have 13 applications or are we going to have 50? So it just kind of helps us with the planning. So those are due on July 29th, and those are just due to me. They can be in the form of an email, or if you want to, put something in Word or PDF it or scan it, that's acceptable as well. The applications this year, we are looking at just like a tighter deadline, but they are going to be due on August 16th. So for every procrastinator out there, that is on a Sunday evening. So congratulations. We will not be accepting any applications after our deadline. So they are due on Sunday, August 16th at 11:59 p.m. And again, those are coming to my email address, and we'll talk a little bit more about what needs to be in there. The other thing on the timeline that I just wanted to point out is that we are hoping for a tentative award notification to be at the end of September, so around September 28th. That will give our board ample time to read, review, meet, and then for us to be able to kind of figure out how the funding falls out. So that's that. And then like I touched on before, we're looking at a project period that goes from October 5th all the way to May 31st of next year. So shorter than what we usually have, but I still think it's a really great chunk of time to be able to get something done. So, okay, I'm gonna go back here. So this was kind of the instructions document. So that's just kind of a general overview of what's going on. So I won't read this verbatim for you at all, but we do have the priorities listed in here. Regarding eligibility, we encourage, but it's not required, that consortium or that members who apply need to be consortium members. So we'll accept any partners, but you do need to know that we will try to get you to be a member of our partnership, but it's not required. At this time, applicants can apply for a maximum amount of $25,000 per year in funding support from the consortium. We are accepting single year applications, so something that you say is going to happen now and it's going to be done by the end of May. Or you can actually apply for a multi-year intervention. So you can say, thinking of Julie again, but this is my plan to test for radon in schools, and this is what I want to do in year 1. So this is the funding that I want, but I anticipate looking forward 2 and 3 years ahead. This is kind of what I'd like to do, and I plan on applying later. Yeah, so you can apply for up to 3 years of funding, but you do have to know that that's subject to like an annual application process. So again, in your application, you can say, I want this to go through 3 years, but every year we're going to ask you to reapply. And then just a final caveat that the total number of grant awards and the dollar amounts on those are really dependent on kind of the grant mix that we get, how the applications are scored, and what our board wants to fund. So we kind of never know that we're gonna, fund only 10 applications or something. It's all kind of mixed depending on what we get. There will be other documents, but you may use grant funds for staff salaries, consultant fees, meeting supplies. Don't know if there'll be a lot of that, project-related travel, but you cannot use funds to cover indirect costs. So those would be administrative or overhead costs for your organization. You cannot use funds for lobbying. You cannot use the funds to replace dollars currently earmarked for cancer programs and for clinical care, so medication, vaccinations, or cancer treatments. I will say that one of the things we put in here was that service delivery, so things like radon mitigation or cancer screening, those will be reviewed on an individual basis. We don't automatically fund those, but if there is a demonstrated need or really relates to health equity, our board looks at that on a case-by-case basis. Okay, projects, you are required to kind of write out an evaluation plan, and that's something that I really think our consortium staff shine. We love to evaluate things and write SMART goals. So I would really encourage anyone, if you are unfamiliar or maybe just want a little bit of guidance here, I really do feel like our staff will be able to kind of help you identify like what might be good goals for your project and just build in kind of those evaluation measures right away, but just take off some of the stress for you that way. We do require that funded grantees submit quarterly reports. So if you are funded, we'll connect with you about that. Let's see here. The other things I just wanted to mention, within our website, we did include a couple of sample items that you'll need to include within your grant application. So one of those things are the budget. So this is just an example of what a budget might look like. And this is actually within the application, this table, so you'll be able to fill it out with your own project information. But we outline just some general areas where we typically provide support. So you could list out that you have a program manager that you want to pay for a certain number of hours and weeks, and then we'll ask you to extrapolate it. Like how much of our consortium grant funds are you asking for that? Maybe what type of other funding, if you work at a public health agency or something, maybe they're not asking for your time to be, what is the word I'm looking for, written into the grant. But then we just ask you to kind of total out just kind of what the total funds, and it helps our board kind of get an idea of what our partners are putting in towards this project and just kind of an overall view of the scope of the project. But again, just like any good budget, we really ask for details. So if you're printing program brochures, we like to know how many, where you're distributing it, and what's the estimated cost. And I think maybe not similar to other grants, we are flexible. I mean, if things in your budget do change once you are funded, we're definitely willing to work with people, but we need to know this information just for what you want to use the funds for. We also included a sample letter of intent. So again, I had talked about that a little bit earlier. It can be super, super simple. So don't let this be intimidating, but this is an example if you want to reference that. We did also include a sample letter of support. So one of the things that we do ask for in the application is that any collaborator that you list within the organization, any partner who's helping you with the project, that their organization or as an individual provides a letter of support. And again, this is really just a way to say, like, you can't just write in that you're working with Kirkwood Community College. We need to know that like they're vested and also kind of what their roles and responsibilities are with the project. So again, this is just an example for you. So I think that's about it here. I did include the scoring rubric, so I won't walk through that, but this is kind of new, so you can check through that and just make sure that you have everything and do a sample score. And then I'm just going to open up the application. We did put the documents in Word this year. So I think that'll be helpful for everybody. We do love a good PDF when you do submit it. So if that's possible, please do that. And if it's an issue for you about combining PDFs into one, definitely contact one of our staff and we'll work on putting that together. But it's just a lot easier for us to make sure that we have all of your information together. But as you'll be able to see, we just ask for a lot of general information. This area is kind of, I can blow it up a little bit. We ask for just some quick project details just so we can kind of see at a glance what you're interested in and again, what priorities you meet as far as what the board has identified. But we do have a section for project objectives, how sustainable your project is, just different things like that. This is the area for project partners. So anybody who's listed on here would need to provide a letter of support along with your application. One of the things that we also really like to include is that, you know, we're not working in cancer control alone. There has already been a lot of people that are doing this work, and we want to make sure that any project that you're doing has its roots in science and in evidence. So one of the things that we did prepare this year is a blog post that contains just some really helpful links to organizations and blogs and colleges of public health that really talk about evidence-based public health. And just being like a cancer screening gal myself, I can think of this just in terms of like, you know, offering incentives for colorectal cancer screening or something like that. You can actually go to websites like this, like the Community Guide, and you can actually go in and look at, you know, colorectal cancer, and I can see what all of the literature is in here and see what's worked and what hasn't, and really get just a good idea of like what works and what doesn't. So this is especially helpful, I think, for cancer prevention and screening. I feel like there's a lot of tools out there for that. So definitely make sure you just check out some of these. And again, if you have any questions or need help kind of building your case, please reach out to our staff members. Okay, so I think this is just about everything. I hope that I mentioned it before, but in a normal year, we usually bring in cancer control experts from like across the nation to review and score all of our applications. So the board kind of sees those like blinded a little bit, and they kind of use like, you know, their own reading of the grant, but then they also see the combined scores from like 3 reviewers. Just given the crazy timeline and just the busyness of everyone this year, we are going to forgo that like national review, but we are going to be able to send this to our board members, and they're going to have a couple weeks to pour over these documents, read through what the projects are, and again, they will each have to score the applications based on the scoring rubric. So that's what we're doing this year, but I just wanted to make sure you knew like who you're writing the application to. But again, our staff does not score these applications, which I think is a benefit to everyone because we're actually able to help and kind of assist with like the genesis of some of these projects. So I am gonna just put kind of the timeline up here. Kelly, do you feel like there's anything that I missed, or are there any questions coming in?
I have been furiously answering questions in the chat box. So to be honest, I have been focusing on that. But I think people are asking really good questions. Maybe should we pause for just a second and see if there's any that folks want to ask out loud?
Yep, that sounds good. So if you want to go ahead and unmute yourself, we'll just have this kind of open time.
Hi, sorry this might have already been answered, but I was wondering if you had a page on your site of previously completed projects for the Iowa Cancer Consortium.
Yes, we do. Yes, we do. So on this main grants page, we kind of tucked it under here. So you can view FY20 funded projects. And if you click there, it will take you back to these are projects that were funded. So just a little description. If you, like Emily, if you do have any questions about any of these projects, we can provide you more detail or context about it. Otherwise, we can definitely link you with the people who are the implementers of it.
Thank you so much.
Yep.
And I'll put that link in the chat box so folks can click directly on it.
Okay. Anybody else have any questions or comments or want to talk about something that they want to do? Okay. All right. Well, we're going to stay on here just for a little bit as a staff. So if anybody does want to stay on, we can answer your questions. But again, I do want to let you know, you can go to our webpage to the About Us and you can click on Staff and you will see all of us there. Email is probably the best way to contact us right now, but please, 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 like, don't be a stranger. Reach out. Like, we want to talk to you. We want to know what's on your mind. So, but I just appreciate your patience and perseverance and willingness to look at this funding opportunity to reduce the burden of cancer. So, all right. Thank you guys so much. We'll see you later. Bye.
Thanks, everyone. Thanks, Rachel.
Yep.